Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Grades of dysplasia. There is mild dysplasia, moderate dysplasia, and severe dysplasia. Mild dysplasia. The dysplastic cells are limited to the basal one-third of the cervical epithelium. According to Bethesda classification, it is this mild dysplasia is called as low squamous intraepithelial lesion. According this was graded as cervical intraepithelial neoplasia type 1. Moderate dysplasia. In moderate dysplasia, the dysplastic cells are between one-third to two-thirds of cervical epithelium. So, moderate dysplasia, according to Bethesda classification, it is high squamous intraepithelial lesion, and the grading is cervical intraepithelial neoplasia type 2. We have severe dysplasia. In severe dysplasia, the dysplastic cells are more than two-thirds of the cervical epithelium. So these dysplastic cells can be present in the entire epithelium also. In the dysplastic cells, the basement membrane is intact. So according to Bethesda classification, high-grade squamous intraepithelial. This severe dysplasia includes high-grade squamous intraepithelial lesion. The grading of severe dysplasia is cervical intraepithelial neoplasia type 3. Invasive cancer cervix. In invasive cancer cervix, overlying basement membrane is broken. So the cancer cells have broken the basement membrane and they started invading the submucosal layer also.
thank you and thank you for watching.